Good morning and welcome to UAB Physical Therapy's COVID Corner. Before we get started with our questions for today, let's first take a minute in this first edition to introduce ourselves. So Ashley, I'll let you start.
I'm Ashley Parish and I'm an assistant professor in the Department of PT at UAB. To tell you a little bit about my background, I'm a board certified cardiovascular and pulmonary clinical specialist. Prior to becoming a PT, I was a respiratory therapist. So my passion is really ICU patient care, especially working with those on life-supporting devices. Most of my PT experience has been in the acute pediatric setting. I want to mention that I'm also part of the PACER project, which stands for Post-Acute COVID-19 Exercise and Rehabilitation Project. So this is an initiative co-sponsored by the Academy of Acute Care PT and the Cardiovascular and Pulmonary Section of the APTA. It's 16 free CEU courses through the APTA Learning Center for both members and non-members of the APTA. And all the courses are around COVID-19 management of those who've recovered from the disease. Mine in particular is one on pediatric considerations. So I'll pass it over to John.
So my name's John Lowman, also in the faculty member in the Department of Physical Therapy at the University of Alabama at Birmingham. And I've been a physical therapist for 25 years and been a board certified cardiovascular and pulmonary clinical specialist for over 20 of those years. And pretty much all of that time, clinical time, I've spent treating patients with acute and or chronic cardiorespiratory health conditions, from managing patients in kind of critically ill patients in the ICU, kind of patients in kind of step down units, long-term care, skilled nursing, home health, and currently also spend some time in an outpatient pulmonary clinic. And as Ashley mentioned, I'm also part of the PACER project. So while Ashley and I both have kind of extensive experience in treating patients with respiratory health conditions, I can't say we're kind of an expert in this area. In fact, I don't think anybody's an expert in this area. Everybody's kind of learning on a daily basis. In fact, kind of in full disclosure, as far as we know, I don't think either Ashley or I have knowingly treated a patient with COVID-19. I think all the facilities where we currently work have either stopped providing patient care to kind of save critical personal protective equipment for hospitalized patients. And some of the places we were work have kind of moved to a telehealth model. And then Ashley and I both do work in kind of an acute care setting as well as PRN staff, but to kind of minimize exposure for staff and standardized care, all the patient is now being done by kind of full-time therapists. So that said, we both do have a strong cardiopulmonary background. We're quite connected with the larger kind of PT community. We're in touch on a regular basis with PTs treating patients with COVID-19, especially in the acute care environment. We both have kind of vast amounts of experience treating patients with kind of mild, moderate, and severe respiratory failure and managing the complications associated with prolonged mechanical ventilation, deconditioning. And lastly, we're both kind of active in our section, in the cardiovascular section, acute care section, Ashley in pediatrics, kind of staying up to date with kind of current evidence and best practice, which, as I already mentioned, is kind of evolving on a rapid and almost daily basis.